Good afternoon or good morning, everybody. Welcome to LTSC's Homesick webinar series, where we explore ways to combat homelessness crisis with the community-based remedies. As we all know, it's a crisis of an epic scale that's impacting all of our communities. My name is Margaret Shimada, and I'm the Director of Service Programs at Little Tokyo Service Center. I have the great honor today of introducing today's speakers who bring years of experience and insight to our discussion as they share how their respective organizations have responded to this crisis. As LTSC steps into this homeless services arena, we feel it's really important to have these open conversations around this very complicated issue. We want to bring all of you along with LTSC in this new venture, so that together we can make an impact. So again, thank you all for joining us. As we all know, homelessness is a complex issue, and we at LTSC don't obviously have all the answers. So like many of you, we're doing a lot of listening and a lot of learning. Despite the complexities, we feel it's important to step into this work to try to be part of a solution. So here we are. The first episode of this webinar series answered basic questions around the homelessness crisis. We were fortunate to hear from our partners at Inner City Law Center and people assisting the homeless. We discussed some of the root causes of homelessness and dispelled some of the myths and stereotypes around homelessness. We also acknowledged the impact that the homelessness crisis has had on our communities. So today, in episode 2 of our 3-part series, we'll hear how local community organizations are responding to the homelessness crisis. As we can all imagine, the work is challenging, it is exhausting, and it is never ending. So we've asked each of our speakers to also share a little bit about their journey that brought them to this work, and that also sustains them. So with that, I'd like to introduce our impressive panel of speakers. We are so fortunate to have with us today Amy Turk, the CEO of Downtown Women's Center, Steve Diaz, the Deputy Director of Los Angeles Community Action Network, and Dr. Keith Tarasaki, Chair of the Board of Directors for Wesley Health Centers. Now, before we begin, I just have to take care of a few housekeeping items. Please note that we're using auto-generated closed captions, so we apologize in advance for any typos or misinterpretations. If you'd like to view the live transcriptions, please click on the live transcript button, which you'll find at the bottom right of your Zoom window. And then after the presentations, we'll have time for Q&A. So please submit any questions you have using the Q&A function that's also in the bottom of your screen. Okay, so let's get started. Our first speaker is Amy Turk. Amy is a licensed clinical social worker and the Chief Executive Officer of the Downtown Women's Center. Downtown Women's Center is the only organization in Los Angeles focused exclusively on serving women who are currently homeless or have experienced homelessness. They envision a Los Angeles with every woman, where every woman is housed and on a path to personal stability. Their mission is to end homelessness for women in Greater Los Angeles through housing, wellness, employment, and advocacy. We're so grateful to have Amy join us today to share more about Downtown Women's Center's comprehensive approach to serving unhoused folks. Amy, thank you so much for joining us.
Margaret, thank you so much. It's really nice to be in company with Steve and Dr. Terasaki and you and our community. You asked what brought us to this work. I always knew I wanted to be in a helping profession and landed in homeless services starting as a volunteer in my freshman year of college in California, and managed to learn how to cook in a shelter and came weekly to cook a meal and sit down with women who were living in a shelter that I ultimately would start to direct eventually in my career. And just being so touched at the openness and vulnerability that I heard as I would sit down for a meal with people, and impressed with the unique stories that brought people into unfortunate circumstances and the amazing resilience that brought people to their next journey of healing. And just being in community has always inspired me and kept me rooted in this work. Now a little over 20 years, basically two different nonprofits, with a primary focus for me on addressing women's homelessness. And so that keeps me sustained, is getting to know the people that we strive to help on their journeys, and the colleagues like you all really keeps me sustained in this work. So thank you for asking that question. It's nice to be able to reflect too, as you know, we are so busy sometimes in this work. I can share just a few slides to share about the model of how we go about addressing homelessness. But I think the current slide needs to come down for me to be able to do that. Great. So I approach this work through a gendered lens, and we'll be lifting up the unique needs of people who identify as female or women or trans women throughout this, because the experience of homelessness is just not a monolith. Everyone has unique needs, and I know our other panelists will lift up those unique needs too. But to share, more about women, the experience of homelessness bears especially hard on women. Homelessness experienced by women is made unique by their disproportionate experiences of gender-based violence, including domestic violence, dating violence, stalking, human trafficking, sexual assault, things like that. Over time, women's health compounds at a lower, women's wealth compounds at a lower rate compared to men due to a persistent pay gap, resulting in higher rental and housing cost burdens and housing instability. And though we're seeing more younger women facing higher rates of first-time homelessness, gendered wealth disparities also force older women no longer able to afford the cost of housing into homelessness. Older women face more chronic health conditions and on average are dying 35 years prematurely than compared to our housed individuals and populations. And of course, due to longstanding systemic racism and sexism, women's homelessness is disproportionately experienced by our BIPOC and LGBTQIA+ communities. We are here because of our founders in 1978, Jill Halverson building a relationship with Rosa, who became our first participant and then our first resident when we moved into providing permanent housing. At the time in the Skid Row community, there were homeless services and social services, but all were 100% geared for men. But in the late 70s, early 80s, we started to see more women experiencing homelessness. So Jill took that into her hands and grew our mission that Margaret has lifted up already. And we became the only social service really exclusively focused on women experiencing homelessness still to this day in Los Angeles County. And we pride ourselves on being the first of many, one of the first women's organizations addressing homelessness, and especially that we moved into what's now called permanent supportive housing early in the 80s. We established how we provide case management in our supportive housing, and that's by the use of an evidence-based practice called critical time intervention. And in partnership with Wesley Health Centers, we became the only women's health clinic in the Skid Row community. So they run their satellite health clinic in one of our permanent supportive housing buildings, still to this day. And we're still one of the only and first places that anyone can drop in for services Monday through Sunday, every day of the week in our day center. And what we find incredibly important and something that is universal to any social service or really any environment for all is an approach of using a trauma-informed lens. This is our umbrella, highest level evidence-based practice for which we make all decisions under, meaning we seek to understand the stories and the unique paths, journeys, and goals of every woman we serve. So instead of coming from perhaps more of a blaming model and lens of what is wrong with an individual, we come from a lens of understanding that something has happened to someone, and we try to create a safe environment where we can learn and tailor services appropriately. And to do so, following the trauma-informed care lens, we use the 4 R's, a practice that can really, again, work for all, any setting, any relationship, any environment, any work environment, where we realize that we realize that all that we serve have experienced a real or a perceived life-threatening trauma. Of course, the experience of homelessness in and of itself is traumatic. And that these traumas over the course of a lifetime demand that we have an understanding of what that trauma means and how it shows up. And so that we recognize what trauma looks like and we don't sort of misdiagnose what maybe could be identified as, for example, anger. That we understand that there's root causes to people's behavior and that we respond in a manner that does not increase the traumatic experience. And in that way, we resist doing anything to re-traumatize individuals. So we really tailor our approach. We try to not come up with rules and regulations that don't work for this population as examples of resisting re-traumatization. And these are our programs that have last year served nearly 6,000 people, a number that grew last year due to an increased need related to COVID, but also that we received new government funding that increased our ability to serve more people, mostly all COVID related. And so we do provide permanent supportive housing in 2 buildings that we own and operate in the Skid Row community, and countywide with landlords that we find for about 500 women that we support countywide. We've found landlords that will work with them, and then we provide field-based case management services. Like I said before, any person can come to our day center every day of the year for a safe place for a meal, a shower, and to start a deeper conversation with a case manager, a counselor, or a healthcare provider, which includes the satellite health clinic through Wesley Health Center. We hire women into our own social enterprise made by Downtown Women's Center and with other employment partners in the community. Our social enterprise includes a coffee shop and a resale boutique, so there's places for anyone to come and shop in the Skid Row community there. And we use our direct services experience and expertise through the work that we do in service of the women to advocate for change. We do this in coalition, we do this through legislative work. We're currently sponsoring a state bill, things like that. So we really use our voice to try to reach more individuals and to impact systems change. So we don't do this alone, and if there's one thing that folks can do in our community, that's to volunteer, whether at the Downtown Women's Center or any of the orgs here or other homeless services. To really get involved is certainly one way to help contribute to the solution to homelessness. We also, like I said, in our advocacy work, do a lot of community-based research. With LA CAN back in 2001, we started a practice of lifting up the voices of women through a needs assessment. We've both carried that forward in different ways, which really helps articulate the expressed need of women and policy solutions on how to end homelessness for women through a needs assessment that's on our website. And LA CAN is really drilled down into the experience of women in the Skid Row community. But lots of toolkits on our website to help you understand more and ways to get involved. Our advocacy toolkit are fantastic ways for any individual to get involved in solutions. And other ways, of course, again, volunteering. I mentioned our social enterprise with Mother's Day around the corner. We have lots of nice products, candles and soaps that could perhaps bring someone joy in your life. But another sort of global way to respond is to just let your local and national elected officials know that you are for solutions to homelessness. Maybe you have some specific ideas around that, but they also they don't just need to hear what people don't want. They do benefit from hearing what people do want in terms of solutions. So thank you for giving me some time to lift up our solutions at Downtown Women's Center, and looking forward to hearing from our other panelists.
Amy, I have to tell you, when I started at LTSC the second time around, Downtown Women's Center was one of the first places I visited. And I was just so impressed, not only with the building itself, but I think Downtown Women's Center really focuses on a whole person approach, right? Mm-hmm. You have your workforce development, you have your social enterprise, as well as the case management services and mental health support and everything else that you provide. So really want to thank Downtown Women's Center for sort of pioneering and supporting LTSC as we sort of work towards that. So mm-hmm. Thank you.
Thank you. You all are fantastic partners. You make it easy.
All right. Our next speaker is Steve Diaz. Steve is the Deputy Director of LA Community Action Network, also referred to as LA CAN. So LA CAN is a Skid Row-based organization which organizes people to fight back against oppression and create social change on issues like women's rights, voter engagement, healthy food access, and the human right to housing. LA CAN's constituency consists of extremely low income and unhoused people, primarily those residing in downtown LA and South Central LA. LTSC has been fortunate to partner with LA CAN on a number of coalitions around equitable development and building power in low-income communities. Steve joins us today to share more about LA CAN's community-based approach to homelessness crisis. Steve, thank you for joining us.
Thank you, and definitely thank everyone who's on the call listening. And I just want to say it's really hard to follow Amy in any presentation. So definitely thanks for the opportunity. So just a little bit about myself, just so folks know who I am and sort of how I come to the sector. I actually never had an idea what community organizing, community advocacy, or any of that ever meant. I was living in the Westlake Pico Union neighborhood where my family, like many others, were suffering from the social conditions that affect people dealing with poverty. And we ended up having to find a place because we were being evicted. And one of the places we were able to find that didn't require sort of all the hurdles that were in place for other type of housing was a residential hotel, which at that time was called the Frontier Hotel and is now known as the Roslyn Lofts because of the work of LA CAN. For me, homelessness is something that's near and dear to my heart, not only because my family has suffered it, but because it's something that you see many Angelenos every day suffering and going through it. And you see the lack thereof by many people to sort of try to put a stop to it. While many, including many folks on this call, are proactively working to address it, it seems like there's a huge gap in terms of trying to stop it, where we're at a point of more people are becoming homelessness as a huge amount of people are being housed at the same time. And I feel like that for me is something super important to uplift in this conversation. As LA CAN, just to give folks an idea who LA CAN is a community-based membership organization that was created to ensure that we had voice power and opinion in the decisions that were directly impacting us. The whole idea was that folks in the neighborhood of Skid Row could sort of be at the decision-making table, because historically, a lot of the providers wanted to act or speak on our behalf and not include us in these decisions. There was a small number of people that sort of saw the importance of that when we were first launched. And luckily the Downtown Women's Center was one of them. And really we felt that through our organizing, we could sort of engage folks to build this long-term institution that could sort of exist in the long term to ensure that whatever it may be that's happening in the neighborhood, we would be able to sort of have the ability to partake in it. Over the course of the years, we originally were founded dealing with civil rights abuses. At that time, when we were originally founded, the city of LA was putting huge amounts of attention on free food provision. As folks know, Skid Row has been historically been seen as a place of an abundance of free food. And one of the ways when you start targeting a neighborhood to change it, wherever way you may want to change it towards, you start removing the resources. And one of the resources that was being removed at that time, that was being targeted to be removal, was the free food provision that was happening. Just to sort of move forward, give folks an idea how we're addressing the issue. LA Can's a little bit different in terms of how we approach versus a social service provider. We don't believe that we're better than that. We believe that our approach is just different. And we believe that all these approaches are needed to ensure that folks' everyday needs are met, but also that long-term systematic issues can be addressed as well, such as racism, sexism, and many other isms that are at play. We believe that through the process of engaging folks in identifying what are the issues that folks are facing in the neighborhood, how is it that those issues were created, identifying the solution, and how they want to implement the solution, we can build the long-term people power to ensure that that's addressed. And that sort of is my 2-cent version of community organizing, right? Is bringing folks together to sort of identify all those things and through the process begin to develop working relationships with each other. A couple of our key projects that I want to highlight that sort of are super important that folks should know is, one thing is when folks hear the words houselessness or homelessness, oftentimes it's a very, it gives shockwaves, right? You begin to think about, how do I address this? What's the easiest way? What can I do? You feel sort of helpless and not knowing how to sort of act. And one thing that Amy said that I want to uplift that's very common is, it's the small things that count. Take a step towards volunteering, take a step towards having a conversation, take a step towards deeper understanding. That's literally one of the easiest things that anyone who is interested in the issues of homelessness can do and begin to change the course that exists, right? It's a hot day, give out a bottle of water. You have an extra day that you want to volunteer somewhere, find a good social service agency, sort of volunteer. If you're interested in advocacy or sort of activism work, join a nonprofit, find a nonprofit that's doing that type of work. It's the very small things that can make it happen. I think 2 is really just look at it from a humanistic side, right? How would you like to be treated as an individual if you were put in that place? Sort of what are the things that are missing that you see that are missing, right? And really start thinking about, how can I help address that? Whether that be through direct action, whether that be through advocacy, whether that be through direct service. And these are the small things, right? These are the things that really impact a person's ability to have a better quality of life. And I would say the third thing is ask questions. Start wondering, why is it that it's taking forever to invest in permanent supportive housing? And then when the investment's there, the city is still making it hard to build permanent supportive housing. Ask those questions, right? Ask the questions around, why is it that the services that are offered, or the money, excuse me, not services, the money that's offered to the good service providers is not nowhere near what's being offered to other city agencies or other city entities, right? Start questioning those things and then start advocating around those things. Are sort of similar or easy sort of to do approaches that everyone can engage in and begin to address houselessness or homelessness, whichever way you look at it. Of course, homelessness is a robust issue that has been many years in the working, but we know that it ends with a house key. And we know that by investing in resources to ensure that permanent supportive housing and long-term affordable housing is there, we'll be able to end it. I think the last piece, and I'm not trying to take up too much time, that I just want to make sure is out there is, it can be seen as a temporary issue. It can be treated as a temporary issue. Homelessness or houselessness needs dedicated funding, dedicated resources to be addressed. And as any sort of outreach worker in whatever sector will tell you, it takes time to build the relationships and the trust to ensure that folks are willing and able to engage whatever thing that's being offered. Even in the organizing world, it takes us 3, 4, 5, 6 times before we're able to get someone in the door to start talking about sort of policy change or talking about campaigns. So I wanted to sort of just come out with, lay out a different perspective, because I feel like these are the small things that oftentimes are forgotten that can make tremendous impact as we move forward. Thank you.
Steve, thank you so much. I think what I heard you say that I'd like to emphasize is that, you know, it starts with relationships, right? I mean, that is the fundamental piece of all this, the foundation. And then LA CAN's work to lift the voices of the residents, you know, who are experiencing homelessness and some of these issues. So really, really appreciate that perspective. Thank you for sharing that.
Just real quick, I know I didn't get to, thank you so much, first of all. I know I didn't get to touch on all the political issues, but I know there's one very apparent issue that I know a lot of folks are hearing about, and that's 4118. 4118 is basically a measure, a city municipal code that basically bans people from sitting, sleeping, having property in a specific area. There's 2 different ways that you can sort of be impacted by it. There's what we call the general enforcement, and that's being close to a door, being close to a fire hydrant, being close to a driveway. And then there's another way that's being used, which are specific designated zones that have its own criteria, which we can talk about more later, or folks can visit cangrace.org or can engage to get more information. The second piece for the specific areas require a city motion to sort of have stairway zones, that are being called stairway zones, to be implemented. So one of the ways people can sort of start fighting those, if you feel or have questions you want to ask about them, is call your local council office. Ask, why is it that there's a fence there? That's one of the easiest things you can do. There's organizing efforts going around in terms of trying to figure out how to repeal and sort of how to take that back. But at this moment, the one clear step, because there's a lot of confusion, that folks can do is just start advocating, start asking questions, start calling the council office. It's pretty easy to find if you do a Google search, and just start asking questions and then talking to your neighbors.
Thank you, Steve. Again, you break it down to the very basics: developing relationships, developing trust, uplifting voices, and asking questions. Basic skills. So thank you for sharing that. Okay, our next speaker, last but certainly not least, is Dr. Keith Tarasaki. Keith is the chair of the board of directors for the Wesley Health Centers. Wesley Health Centers is the largest provider of homeless health care in California, with 35 sites, including primary care sites, dental clinics, school sites, mental health and substance treatment sites, and mobile units. Keith is also the assistant chief of radiology at Kaiser Sunset and serves on a number of nonprofit boards. We're fortunate to say, including LTSC. He's been on our board for a few years, so we really appreciate that. Dr. Terasaki brings a unique perspective to the table as a leader in the Japanese American and Little Tokyo communities, and as a healthcare provider. We're excited to hear about his personal commitment to homeless services and how Wesley Health Centers' compassionate approach is making an impact. And Keith, I hope you share also a little bit about how Wesley sort of stepped in to help LTSC during the pandemic. Keith?
Okay, thank you, Margaret. Good afternoon, everybody. It was great to hear from Amy and Steve. I'm going to talk a little bit about my involvement with the Wesley Health Centers, also known as JWCH. I grew up on the west side of Los Angeles. I received my medical education at UCLA and at Stanford, and I've worked at the Kaiser Sunset Medical Facility for the past 25 years as a radiologist. I was chief of the department for around 10 years. I had a fairly relaxing career, but around 15 years ago, someone called me from the Los Angeles County Health Department and asked me if I would like to voluntarily read out x-rays for the Wesley Clinic located in Skid Row. It wouldn't be too difficult, maybe taking about 20 minutes a day of my time. They would drive up the films to my office daily and I would interpret them and send them back a report. I really hadn't done any type of volunteer work before. I decided I wanted to visit the Wesley Clinics before working with them. I had never been to Skid Row before, even though I grew up in Los Angeles. So I drove to the clinic and I had to park about 2 blocks away. Even though it was daytime, it was unnerving to walk through Skid Row to the clinic. The Wesley Skid Row Clinic is in the midst of Skid Row with homeless people milling all around the clinic. It does provide the majority of medical care for the homeless population on Skid Row, and it's actually the largest homeless clinic in the country, serving around 12,000 different patients annually. When I arrived at the clinic, patients were waiting everywhere. The building was somewhat run down. It was in no way what I was used to at the clinics at Kaiser. But as I walked through the clinic, I talked to the staff and the physicians there. It struck me how dedicated these people must be to work at this clinic. I knew that most of these people could work elsewhere, but I immediately admired them for working at this clinic. I decided to help read x-rays for the clinic, and I still do this today. About 10 years ago, a position opened up on the Wesley Clinic Board of Directors, and they were looking for a physician. They asked me, and after some thought, I decided to join the board. Beside the clinic on Skid Row, Wesley runs several other clinics for low-income people in South and East Los Angeles. The Wesley Clinics is a federally funded community health center. To qualify for these federal funds, the clinic has to offer medical care to indigent patients. We never turn away any patients. Visiting these clinics really showed me how many people in the county live in or near poverty levels, and they were desperate for good medical care. Our reimbursement rates from the government are low, and we have to be very careful and efficient in how we run the clinics. The clinic in Skid Row is especially challenging as the majority of patients are homeless with many complex underlying issues. One aspect that interested me immediately was the infectious diseases that would show up at the Skid Row clinic. Not surprisingly, there is a fair amount of infectious disease in the homeless population. Many of these patients are malnourished, living in cramped conditions with cold nights. If they have diabetes, it is often out of control. So the homeless are predisposed to get pneumonia. And once they get it, it is often difficult for them to get treatment before they get too sick. It is difficult to get many to comply with taking their medications. Tuberculosis in particular is difficult to diagnose as the onset is frequently insidious. Treatment courses with antibiotics for tuberculosis can last for months. Unfortunately, there are often tuberculosis patients in Skid Row who are undiagnosed or incompletely treated. We are doing our best to keep it in check. There are also other opportunistic pulmonary infections which occur in debilitated persons living in the streets. And we don't see these type of infections in the general community. Another infectious problem that we see at Skid Row is HIV. And these patients can contact it through IV drug abuse or casual sex. We actively seek out high-risk patients to screen them for HIV. In our clinics, we follow roughly 1,000 patients with HIV, making sure they are getting the appropriate treatment and taking means not to spread the disease further. Over the years, if our clinic did not follow all these patients, the HIV problem would be much worse in Los Angeles. We detect and follow other infections which are increased in the homeless population, such as hepatitis, which can be spread by needle sharing, and a number of sexually transmitted diseases. We know that if we did not help keep these infections under control, it could spread rapidly amongst the homeless people. It could then spread into the nearby affluent neighborhoods. Besides infectious diseases, there are many other serious medical problems that we see at our Skid Row clinic. There is a fair amount of IV drug use and alcohol abuse, both acute and chronic. There are problems such as trauma, neglect, and malnutrition, not to mention diabetes, hypertension, and kidney disease. All of these occur in greater incidence than the surrounding community. There are also a large number of chronic homeless patients who suffer from mental health issues such as schizophrenia, depression, and antisocial behavior. Over the years, we have received special funding and grants to help us with many of these and other issues. We also now get grants for dental care and have been able to open up a dental clinic every day of the week. Homeless patients have lots of problems with their teeth. We have grants to be able to offer free eye care and glasses to anyone who needs or loses their glasses. And we are able to provide prescription medication for free to those who can't afford it. As you can imagine, it is very difficult to get homeless patients to return for follow-up appointments, even if they are sick. But we have funding now for an outreach team. This team walks around Skid Row every day looking for patients in trouble or those who need follow-up appointments. Many homeless patients need their medications refrigerated so we can deliver them to the patients on the street. I've been chairman of the board of the Wesley Clinics for the past 5 years. We have been fortunate to get funding to expand our clinics. We have established approximately 20 new clinics elsewhere in the county, all in low-income areas. In Skid Row, we were able to purchase the adjacent building and expand our clinic a few years ago, and now we actually have a small parking lot. We have been able to hire more security within the clinic, so now it feels much safer to be around the clinic. Another project we started a few years ago is providing a service called Recuperative Care. These are facilities that we run and fully staff. They're open 24 hours a day and are for homeless patients who have acute medical or mental problems, but are not sick enough to be admitted to the hospital. Patients can stay at these recuperative care centers until they recover or find other housing. Besides taking care of unsheltered patients with acute medical conditions, we can also take patients directly from hospitals when they are ready to be discharged, but have no home to go to. These recuperative beds have been found to be very valuable in helping to take care of the homeless who have acute medical problems. Otherwise, it's very difficult to treat them on the street. We currently have around 300 such beds in the central LA area, and we have plans to build 200 more recuperative beds in the next couple of years. Of course, we were dealing with all these issues when COVID struck. Early on, we had several emergency meetings with the city and health department. In the worst case scenario, we were worried that COVID would run rampant through the homeless population, with few patients wearing masks or socially distancing themselves. If COVID were to spread unchecked amongst the homeless and it was ignored, it could possibly serve as a nidus for COVID spread to the remainder of the city. We were worried that if the Skid Row population all developed COVID, eventually the social service workers and other workers in Skid Row could theoretically catch the disease and spread it to their families at home. This was a serious worry at the start of the pandemic. We were even worried that our Skid Row clinic would be forced to close if too many of our employees got COVID. We, along with other Skid Row organizations, helped to educate the Skid Row population about COVID. The Skid Row area was slow in getting COVID tests and personal protective equipment compared to the rest of the city, but we helped test a number of symptomatic patients for COVID. The problem was what to do with a homeless patient who tested positive for COVID. We couldn't let someone with COVID just live on the street with other homeless patients. So after some deliberation, we opened up COVID quarantine housing units within our recuperative care centers. We use these beds for COVID positive patients who were not sick enough for hospitalization. We wanted to get these COVID patients off the street as a way of trying to limit the spread of COVID amongst the homeless. Throughout the pandemic, we watched hundreds of COVID patients. We had around 100 of our own employees take care of these COVID patients, and much of this was before any vaccine was available. So these workers did the laundry, clean the rooms, serve food, and maintain order of these homeless patients with COVID. About a third of these employees came down with COVID, and some became very sick, but fortunately no one died. It really is truly incredible to me that so many of our staff stepped forward to take care of these homeless COVID patients, especially before the vaccine was available. Almost anybody early on had a good reason not to take care of COVID patients. There was fear of getting the disease themselves or fear of taking it home to their friends and family. When the COVID vaccines came out, we wanted to vaccinate the homeless. We were unsure, though, how many would agree to be vaccinated. We were very happy to see, however, on the first day our vaccine clinic opened in Skid Row, that the line of patients looking for vaccination went down the block. Overall, our clinics have now vaccinated over 80,000 patients in the underserved areas of Los Angeles. And if you look at Skid Row, approximately 60% of the homeless in Skid Row are currently vaccinated. We're still trying to get the rest in for vaccination. One last thing I will mention is mental health. We can now get reasonable reimbursement for mental health visits. We recently purchased an adjacent building to our Skid Row clinic, which we will dedicate to helping the mental health of the homeless Skid Row patients. Hopefully it will be open by the end of this year. So helping the Wesley Clinic has been one challenge after another. One thing I'd like to make clear is that I mainly go to meetings and help with advice. I'm not a frontline worker. The healthcare staff at our clinic are the people who deserve most of the credit for keeping the homeless patients relatively healthy. The homeless deserve good medical care. I described some of the unique conditions they face. Diseases of the homeless are challenging to diagnose and treat with all the underlying problems and social issues. Sometimes people ask me why I help out the Wesley Clinics. Well, all I could say is, take a visit to Skid Row and visit the clinic. To me, it seems like another world there, certainly different than the hospital I work at a few miles away. It's actually hard not to think of reasons to help if you can. Regarding the homeless, I couldn't imagine the thought of spending one night on the streets of Skid Row. I wouldn't feel safe at all, and certainly would miss all the comforts I have at home. To think that many people are forced to do this night after night is really just truly mind-boggling. Visiting and getting to know the Skid Row Wesley Clinic and listening to the patient's story, it's such an experience. Our goal there is to try to better equalize the healthcare between our Wesley Clinics and the rest of the community. We want to lessen the disparity. We still have a ways to go, although I feel it's encouraging in that I could see some significant improvement over the past 10 years. Thank you very much.
Keith, thank you so much for that wonderful presentation. LTSC is fortunate to have you on our board, as is Wesley Clinic and our Wesley Center. And I think having that connection literally saved lives during the pandemic, when a lot of our seniors living in affordable housing complexes in Little Tokyo couldn't navigate the system to get vaccinations, right? A lot of them didn't have the technology and they didn't have the language. So I remember at a board meeting with Little Tokyo Service Center, we talked about this. And I think within a few days, Keith, Wesley Clinics called and said, we're going to provide a mobile clinic for your seniors at the newly built Budokan, Terasaki Budokan. And they actually came out and did this 3 times, 2 vaccinations and the booster. And Keith, even though you say that you sit in board meetings, I know you were out there at all 3 vaccinations, checking the residents, making sure they were okay after they got their vaccinations. So really appreciate the support that you've provided and that Wesley has provided in terms of saving lives. We're really grateful.
Yeah, I'll just say that at the time, I mean, this is when the vaccines first came out, and
Just coming
I don't
out.
know if people remember, it was hard to get a vaccine for most people, and especially if you had means. But if you had no means, it was really difficult. And one of the things that we did at the Wesley Clinic is we were trying to identify the areas of Los Angeles that had difficulty getting access to vaccines. And so we set up these clinics in different parts of Los Angeles, sometimes at parks or community centers or something like that. And it was right about that time that, yeah, I was listening on a board meeting for LTSC, and somebody, might have been you, Margaret, said, that we talked about the problem of getting these patients from the Tokyo Tower, getting them vaccinated. And I thought, well, hey, we could probably help out there. But yeah, that's been a big part of what we've been doing for the vaccination, is to try to get it to people who have difficulty getting vaccinations.
Mm-hmm. Thank you. Just a really one observation that I heard from all 3 of the speakers is just the importance of volunteering. I think you all said it in different ways and in different scenarios, but I think if there's one big takeaway from this panel is that, volunteers are such a important resource to all of our organizations, right? And for people that are listening in, if you have any inclination, any interest in learning more about any of these organizations, to just reach out. And I think volunteering is one way to just get in there and to really understand things from at the very grassroots level. So thank you all for raising that up.
Can I just add something to that?
Sure.
Volunteering is also a good opportunity for folks to learn more about the issue on their own as well. Because oftentimes, the media portrays a certain type of message. We hear a certain type of message and other urban myths and legends. One of the best ways to know what's going on is just to be there hands-on. And it helps you build relationships with people so that sort of the stories hands-on at a deeper level, right? There's a reason why Keith was there the day of the vaccine clinic. It's because he cared about the folks he was talking about. And that comes from sort of the commitment, but also that comes from the experience of one-on-one sort of building that type of communication.
Yes, definitely.
Yeah, I'll just say that I realized that, I lived a sheltered life and that I had never been down to that area until recently. And so one of the things that I did was, when my daughter was in high school, I got her to volunteer at the clinic, and I wanted her to do that to see what it was like. And so she worked at the front desk and she worked at the back desk, and she also worked with the outreach team and walked around Skid Row. And she just did it for several weeks, but I thought it was very good exposure for her to see it and not live such a sheltered life.
Mm-hmm. Thank you. All right, so now we move into the Q&A section. Again, if you have any questions, please use the Q&A button that you see on the lower part of your Zoom screen. And there are a lot of questions, so we'll try to go through and answer as many as we can. Now, this is a question to actually to any of you, any of the panelists. Many people have the idea that people experiencing homelessness are on the streets due to some failing or fault of theirs. For example, they can't hold jobs, they fell into substance abuse, but it's always portrayed as a weakness. How do you talk with people who have this view? Again, this is for any of our panelists.
Oh, go for it, Amy. I'll go after.
No, I'm still mulling it over.
I would say a couple of ways I would suggest like sort of how to talk to folks about it. One is the data is very clear, right? Folks experiencing homelessness are there because of unaffordability, because of systematic racism, because of deindustrialization. And that sort of has been proven in time and time again after each homeless count. And the homeless count data shows that. A couple of reports from LASA sort of share that. But one of the ways I would say that I recently started asking folks is, so do you believe the rent is too high? And the reason why I would say that is because if people start realizing the direct link to it and sort of how folks can become houseless so fast because of the rent being too high, and a lot of that being exposed recently through COVID, can start changing the conversation. So I would say personal question, some type of personal question, however comfortable you feel. And two, if you don't feel comfortable with that, just pivot to the data. The data is very clear on how where folks are at and why folks are there.
There's not one story of someone who's experienced homelessness that to me I can't trail back up to a policy that didn't go right. Like a woman who lives with us now worked for MTA, middle class, was able to stay housed, pay bills, then needed to be treated for cancer. And her medical leave, she needed more time than the company provided for medical leave. And so she took that time and ultimately wasn't able to get back on her feet financially to pay the rent. So, think of like access to healthcare as one major reason that could lead to homelessness if someone doesn't have access. And then, if you look at the stat, like, of course, things like chronic health conditions, substance use, severe mental illness factors in, but those things have been around as long as people have been around. But the numbers of homelessness haven't been as high until starting in the 70s, 80s, 90s, when a lot of policies related to how low-income housing was paid for or developed changed or went away. So from my perspective, it's also just a math problem. There's not enough money to pay for the rent, and there's not enough housing, creating a huge demand on housing. And then who gets housing is usually answered by how racism has uniquely played out in America. So there's so many more root issues than what people so easily see, and then sort of kind of make up in their brain of why homelessness exists, which sort of tends to tie into a personal failing and as more than a policy or a political failing.
Yeah, I'll just say, I agree with all that. And the sad part is that the housing rates are so high in Southern California. And if you look, I don't remember the number, but there's a large number of people who spend really too much of their income on housing. And so they are all at risk. And as you said, one little thing goes on and suddenly they can't afford their place that they're staying. And so I know that every month, people can't afford their housing and in some way become homeless. And I think that's the underlying problem.
Over 700,000 people were rent burdened, meaning they were paying over 50% of their income in rent before the pandemic. When the pandemic hit, there was a study done by UCLA professor Gary Blasey, which projected a little bit under 400,000 people could face houselessness at that time. So just to give you an idea, sort of how broad the numbers are for folks that are listening.
Thank you. You know, as a follow-up to that, again, this is open to all panelists. We talked a little bit about the perception of homelessness as being looked at as being the fault of an individual for some reason. And I think sometimes that perception is generalized to certain areas, such as Skid Row, right? So as a community, as Little Tokyo, what are some ways that we can practice solidarity with our Skid Row neighbors to sort of fight that perception?
I think that, you know, I always come back to the trauma-informed lens, the practice of, you know, maybe internally asking yourself, not what's wrong with this person, not what's wrong with you, but what happened to you, and seeing it from that lens. Not, I don't recommend walking around town and saying, what happened to you, what happened to you? But like, you know, just kind of thinking in the back of your head, something has happened. And I don't know how that gets you all the way to solidarity, but I think having that lens can reduce the anger, the fear, the calls to city council to, you know, require people to move, instead of the calls to city council saying, what more services can we provide to help our community? There's just some thought that came to mind.
I would add to that. I would say definitely what everything Amy said, and I would just add, like, there's been historic solidarity between sort of the struggles of folks in Little Tokyo and the struggles of folks who are either currently in Skid Row or have came because of systematic issues to Skid Row. So not forgetting the history, I think, is super important. As we're thinking about solidarity. I think that's one. I think two is not purposely allowing for communities to be divided as part of that, and really uplifting, like, we're one big downtown. This is one big downtown that if we look at it from a humanistic perspective, we can better sort of folks that have been here for decades, not these new folks that are coming down.
Okay. Keith, this next question is for you as sort of a follow-up. I think you are obviously regarded as a leader, and understandably and justifiably, in the Japanese American and Little Tokyo communities. So what are your hopes in terms of Little Tokyo's response to the homeless crisis? Any thoughts on that? You've sort of, you know, you've done work in Skid Row, you've seen some of the misperceptions. How would you hope Little Tokyo might respond?
Well, I think, you know, Little Tokyo is helping by trying to provide affordable housing. And yeah, I don't know if a lot of people know that, but it's amazing how many supportive housing that Little Tokyo has created. And I attended the last meeting about this, and it sounds like there's a lot of plans going around to provide more supportive housing. And I think that's important because, you know, as we sort of mentioned, there's a lot of people on the verge of becoming homeless. And what you want to do is make affordable housing so these people do not become homeless. And, you know, every day we're helping to house some of the homeless, but every day there's more people who become homeless. And so I think the key is building these affordable housing so that these people do not become homeless. And I know that's a major goal of the Little Tokyo Service Center.
Just if I could just chime in, a friendly little plug. So Little Tokyo Service Center, LA CAN, and the Southeast Asian Community Alliance are leading a coalition called Central City United that's really focused on land use and sort of how to ensure that as land use policies are being reformed through our community plan, there's adequate attention being built to incentivize affordable housing as well, outside of what the service center is building themselves. So really ensuring that there's some type of community equity that comes back as land use is being sort of re-looked at and how it provides benefit for some and not for others. So supporting Little Tokyo's efforts as part of that would be amazing as well.
Thank you. All right, the next question that I see is directed to Steve. Steve, can you talk a little bit about the importance of self-determination among unhoused individuals? Would love to hear about why LA CAN feels that it's specifically important to build power.
Yeah, unlike many of the people that have really big, high buildings and a lot of money across the city of Los Angeles and rich 3D developers and so on, we have people power. And that one of the ways you can confront sort of a monetary power is by the power of the people. So we feel that it's super important to ensure that folks are not just out there confronting, protesting for the lack thereof, but are doing that with a concrete understanding of what the issues are that they're wanting to address, the issues are that we're trying to sort of address, and also are able to understand how the system works. Because we're not trying to sort of have a space where a few people recreate the space that we're fighting against, where a few people have all the answers. We want to create a space where everyone understands how this works. Why is it that we're there? What is it that we're doing? And in the process, really build this collective power of people that goes not just in our base, but one of our key sort of organizing strategies is coalition building, because we know we got to be able to amass the power of people in order to continue to move and benefit our communities.
Thank you, Steve. Amy, this next question is for you. You mentioned earlier about the percentage increase in the number of women falling into homelessness. Why is it that this and the impact of homelessness among women is not more widely talked about and addressed?
Sexism maybe is the root, but I think, you know, when you're trying to solve a big problem, you kind of try to come up with one solution. So when you think about 60,000 people experiencing homelessness across Los Angeles, if you're a policymaker or funder, you're just kind of thinking like, oh, what's the biggest impact I can make? And it's hard to drill down to the unique needs from a culturally responsive lens, regardless of what group, what age group, what gender expression, cultural backgrounds. Like, there's so much to factor in to provide really effective services. So yeah, we could, plant down a big shelter, but will it work? I think it would work better if you think through all the unique needs that people bring, and how they need to be addressed, that they'll use those services more effectively. Women come to us because they know that it's a trauma-informed, feminist, women-centered environment. So, we really take it upon ourselves to make sure that women are included in planning. That's our whole state bill. Actually, it would require any HUD-funded state program or government-funded program in California to have a plan to address homelessness among domestic violence survivors and women. So any city or county or what's called a continuum of care would need a plan. And it's not just about women, it's about all populations really do need tailored plans. You don't go into an emergency room and for a heart condition and end up getting treated for, an eye problem or something. It's all tailored and unique to the needs.
Mm-hmm. Okay. Kind of a follow-up to that, Amy. How does the Made by DWC Downtown Women's Center social enterprise model factor into all of that in terms of helping women?
Yeah, when you look at a lot of the work programs that are available, especially for people with barriers to work, they're really in male-dominated sectors or cater really to more men than women. We hear a lot that people feel are participants feel a little bit uncomfortable sometimes in those settings, or like in a construction setting, and we also work with older women who may not be physically able to do some of the jobs that are out there. So when when the city helped us move into the building on 5th and San Pedro, part of the requirement was to have a community-facing space. And we surveyed the women, really worked with them. What could that look like and be something that benefits them, benefits the community, and the social enterprise emerged. So we employ program participants to work in our stores, the coffee shop on 5th and San Pedro, the resale boutique on 3rd in Los Angeles. And they're also making a handmade product line of candles and soaps and gift cards that are sold in the stores, sold online, and in other people's businesses. So it's a way to give them employment opportunity, fill in resume gaps, but I really see it as an empowerment program. Many folks have employment experience that come to us, but through the experience of homelessness and trauma have lost the self-esteem it takes to be in the workplace. And we try to create a really safe place for people to reemerge on their career path.
Yeah, I mean, I love that because it's empowering women at so many levels, right? And as you say, I think a lot of them have lost the confidence to support and to take part in these things. So I think that's wonderful. And again, it's not too late to get your Mother's Day gift if you haven't done so. So run down there.
Thank you.
Okay, next question. This is to anybody, everybody. Some candidates in the LA's mayoral campaign are linking crime and homelessness, which increases a lot of the fear that people have about the unhoused. Can you address this, and how would you address this? Again, that's open to any of the panelists that would want to speak to that.
So we had a pre-plan, we'd give Steve all the hard questions. I would really want to emphasize, though, that unhoused people are more likely to be victims of crime than perpetrators of crime, by far. And I don't see the linkage myself.
Yeah, I feel like there's a couple of things that need to be addressed in order to get to that. I think Amy hit one of them. I think the other is, how can it be that every report that was in the news about 4, 5, 6, 7 years ago to about a couple years ago was all talking about crime trends are down. And all of a sudden, when there's a huge push to defund the entity charged with quote unquote tackling crime, crime trends are up now. And it's very visible in the news, it's very visible everywhere else. So I feel like there is a question to ask around that as we're talking about what type, and if how much that crime is happening, quote unquote. Two is, there's a clear push and there's a clear play when you look at the budgeting process that's happening in the city of LA right now. Are we going to invest in programs and social services, or are we going to invest in policing? And the policing union and the police unions have a lot of power to influence sort of mayoral elections in terms of how much they can support one way or the other. So I think that's something else to think about as we're having this conversation. What is the role of the police union in the mayoral election? I think three, there has been a change in how, trying to figure out how to say this in a different way. There has been a change in terms of how politics, the political pendulum is moving in Los Angeles. For many, many years, folks fought for permanent supportive housing through the creation of Proposition HHH, at the county for Measure H. And there has been a more tough on crime sort of rhetoric that has now emerged because of whoever or however that happened, wink, wink, that is now changing this narrative where now every mayoral candidate has to be seen as a tough on crime, can't be seen as the caring, compassionate person. They have to be seen as the person that's going to throw everyone in a jail cell in order to move the votes or the voters that they're looking to garner. And the sad part about it is a lot of this happened because of a lawsuit from the LA Alliance case, where a bunch of property owners in downtown were not happy around protections, constitutional protections that were affirmed for houseless individuals. And there was a huge push to sort of begin to change that conversation at the city level through the litigation. So there's tons of different reasons why the mayoral candidates are sort of pushing a tough on crime agenda, but those are some things that are super important to think about. And the sad part of all of it is it's not just one, it's all of them. All of them are pushing the same agenda to either continue to fund or increase or sustain and increase other ways, which all sort of create a city that is no longer a city for folks that we're trying to help and keep in the city, but it's a city that caters towards the rich.
Thank you. Thank you, Steve. And Amy. Okay. The next question, it kind of switches gears a little bit. We talked about volunteering. I think all three of you talked about volunteering. But what are some of the other ways that ordinary, untrained people can be supportive of people who are unhoused in our day-to-day interactions? Steve, I think you mentioned things like just providing a glass of water or but what are some of the other ways?
I so frequently hear how people feel invisible when they're experiencing homelessness. And that they're just literally, we just walk by people all the time. And that happening day after day after day just really, embeds in people's soul. And I've been in lots of, facilitated support groups or therapy, and just like hearing that isolation that comes out of homelessness. So, to the degree that it's safe, just saying hello to someone, giving a head nod, politely declining if you don't feel comfortable giving, if someone's asking for something, acknowledging. And sometimes that's not always safe. Just trust your gut. That's what I do. But, we're human, and just saying good morning can really make a difference.
Amy, I think that's a really good point. I think we've all felt, or we can all relate to that feeling of feeling invisible, at different moments in life, and how that feels. So for someone that experiences that every day, what that does to the individual. So I think your suggestion of just a hello, acknowledgement that they exist is so important. So thank you for sharing that.
I would just say that there are a lot of very good nonprofit organizations that work with the homeless and work in Skid Row. And so if you have some money to donate, I think it's great to give it to these organizations. I personally feel that's in the long run better than giving it to someone who's begging you for money or something like that. And I think if you support these organizations, the social organizations, I think that's better in the long run.
Keith, you kind of spoke about it earlier, but some of the work that we do is not glamorous. You're not going to end up on the front page of a newspaper. You're not going to, it's just sort of digging in and doing the work, right? And I think you shared about some of the workers at Wesley Center that were there working with patients that had COVID. And and it's just the hard work. So I would agree with you that if people do have the capacity and the interest, you know, some of these organizations may be off the radar a little bit, but are doing such incredible work. So it's important to support them.
Yeah, and one of the things that we see over the years is, you know, we try to open up these clinics in areas of need, but we don't make a big deal about it. I mean, if we announce it and have this big pre-opening, well, we could get closed down by the community.
Mhm.
And it's sort of unfortunate,
Mhm.
but yeah, so we don't necessarily try to publicize everything we do. I mean, it's sort of unfortunate.
Mhm. Mhm. Yeah, that's a really good point.
I would just say there's something really easy that folks are going to be able to do on the November ballot. United to House LA is going to it's going to be on the ballot. It'll be a ballot initiative that will ensure that there's dedicated resources to building affordable housing, such as what Little Tokyo Service Center is proposing and the Downtown Women's Center has in the pipeline, I believe. It also will have monies allocated for homeless prevention. So really tapping the well to make sure that folks aren't coming on the street as we're sort of getting folks housed, making sure folks are able to stay in their housing with homeless prevention and eviction prevention. I'll have some rental assistance money, I believe. So that's one easy thing that folks can do.
That's a great point. Thank you, Steve. All right, we have about 9 minutes. So we want to give each of the panelists a couple minutes. If you have any closing thoughts, maybe questions you yourselves have, you have the floor for 2 minutes.
You got us. We were really thorough.
Let me ask you, Amy, do you feel that having these conversations are helpful?
I do.
Okay.
I really do. You know, you can't just read the LA Times every day and like have the full picture. This complicated, complex social issue. And unfortunately, you know, if we knew that there was solution 1, 2, 3, we would have done it. You know, we're just moving forward. And like Steve said, the pendulum swings every 10 years or so, depending on sort of the political winds. And that kind of throws nonprofit agencies who establish best practices, who knows what works, and we try to advance it. And then sometimes things dramatically change too. So like staying the course with things that we know work, in my opinion, is really important. You know, I now have like a 22-year lens of how policies impact what we do, yet a deeper understanding of the evidence-based practices that work too, and just staying the course. And, you know, yes, there's perhaps more money than ever before, or not really than ever before, but right now there's a ton of government money, but it's one time money or 1 year. If you're, you know, if you run a business or anything, how do you make a plan for stuff that ends June 30th when you want to go big and you want to like be bold and address a huge problem, but you can't see the finances beyond the next fiscal year? That's really tough. Sure, there's money to go renovate housing right now. There's no money to sustain it for the 55-year covenant on low-income housing. So that we need long-term vision here that goes beyond a political cycle or a term.
I think that's a really good point. I do think a lot of, not a lot, but certain funders are looking for innovation, but with no plans for funding sustainability. So it's hard to innovate and create when you're going to be kind of scrambling to look for funding to sustain the program. So really good point. Keith or Steve, any closing comments?
Yeah, I'll just say, you know, we talked about the Wesley Clinic on Skid Row, And that certainly is very unique with the population they serve. And, we do get a certain amount of attention because of that. But I'll just point out that it's actually a very small portion of the Wesley Clinics. We have over 20 sites, and they are located throughout the indigent people in Los Angeles. And so there's many more that we serve there. And they also have different challenges. And, at times we have trouble getting the patients in until they become very sick. And, there's many patients, we take care of a lot of patients who are not citizens. And, again, they don't come in until they're very sick. And so we have lots of challenges throughout the city, and the Skid Row Clinic is just one of our clinics.
Okay. Thank you.
Yeah, I would say a couple things in closing. One is, I didn't speak a lot about the work of LA CAN, so if you're interested, go to cangress.org, CANGRESS.org. And then I would say, just always remember from the perspective of, that could be you, that could be us, that could be any one of us. And just keep that at the forefront as you're engaging, because something as little as hi can mean the world.
That's a really good point. All right, we're drawing to a close. Really want to thank Steve, Amy, Keith for not only sharing, the work of your organization, but also just a little bit more about yourselves and what keeps you in this work despite challenges, despite politics, despite all the hurdles that we have to overcome. So really want to thank you all for sharing that. I want to let you know that our third webinar will be LTSC's approach to combating the homelessness crisis. That will be, I think, sometime in June. We'll send out announcements to at least everybody that's participating or joining us today. So you'll have an opportunity to join that conversation as well. But again, really, really want to thank all of you for a really insightful, impactful discussion. And on behalf of LTSC, we are so grateful. We partner with each of your organizations. And as we are listening and learning, we are learning so much from each of you. So thank you so much. With that, I think it's a wrap. Thank you all very much. We'll look forward to seeing you at the next webinar.
Thank you.
Thank you all.
Thank you. Thank you.